captain of sheriff's office. Michael Walsh, captain at the jail.
Georgia Arno, CFO for the sheriff's office. Administration information.
I think I'm jail lieutenant.
Jen McCormack, sergeant at the jail.
Jaja Weed, jail lieutenant.
Go up to the screen. It's always hard to figure out what order you guys are in.
Hi, Tanya Clark, Nevada County Superior Court Operations Director.
Thanks, Tanya. Jump in there.
Ryan Gruber, Health and Human Services Director.
Jesse Wilson, District Attorney's Office.
Alex Gamble, Grass Valley PD.
Phoebe Bell, Behavioral Health.
And we also have Lorena. Can you introduce yourself? All right, no Lorena. Rachel.
Nevada County Superior Court, Court Services Analyst.
Does anyone know who Lorena is?
Didn't catch the last name.
Okay. So roll call just for the minutes. We have Jesse, Carrie, Ryan, myself, Alex, and Tanya, and we have several individuals from the sheriff's office, but we've had a discussion before, and maybe we should have this now on if it's not the individual that's assigned as the executive committee member, as to like if another one can be assigned. So we do have a quorum. And so let's start with approval of CCP minutes from the last meeting. Can I get a motion to approve minutes from the last meeting from someone from the exec committee?
There's a typo in it.
Okay.
I was in attendance at this meeting.
You catch that?
Yeah.
Okay. Is that a motion to approve as well?
Yes.
All right. Can I get a
Second.
second? Any other discussion other than that typo? Anything else that needs to be changed in there? Hearing none. All those in favor, say aye.
Aye.
Any abstentions? Any objections? Hearing none. All right. Any public comment? Okay, Lorena, case manager, Alliance for Workforce Development. Thank you, Lorena. I don't think there's any public here to do public comment, so we can move on to that or past that. And so I guess I'll add this on at the end, the second piece. Innovation funds update. So I think Angie has a brief update on the innovation funds as far as.
Yes.
And I think just to remind people, there is a statute that says that we have to put aside a certain amount for innovation funds. Is that correct? And there's some parameters around how we use them, but that hadn't been done. So we had spoke to the auditor to try to do that.
Correct. Is there a separate section for budget update, or should I roll it all in one? So it's very brief. So innovation fund update, like the chief said, there's legislatively mandated innovation fund, which basically pulls a certain percentage of the growth dollars from every 2000 realignment account. So that's the DAPD fund, trial court security, community corrections, and juvenile justice. And that started in fiscal year 15-16. So, this was information that was sent around to the exec team, since we kind of discovered this wasn't happening, and we're finally getting around to getting it, getting the auditor to set this up for us. So ultimately, we're looking at, as of the growth that came in for 21-22, we're looking at just over 200,000 in this innovation fund. Once all of the back pay is moved over, which the auditor is working on currently. That process, when we worked with this, with the auditor's office and the CBO's office and the different departments, were given, some input on this. Also, what we're looking at is we basically have one fund that's kept, one sub account kept in our CCP fund, in the 1482 realignment fund. the requests for use of this innovation fund will go through the CCP, through the normal budget process, essentially. So, anybody can bring forward an idea of what they think is a proper usage of these innovation funds. We probably, maybe at some point in time, I could try and find the language in the legislation and kind of send that back out so everybody's got a fresh idea of what it is. But ultimately, anything that's an appropriate use of any one of those sub-accounts that I mentioned could be covered under this innovation fund. So it's really open to a pretty broad usage ultimately. So I will have the chief let everybody know once this fund is fully up and running. Like I said, the auditor's working through the process of going back to when it was enacted in 15, 16 and pulling those little bits over into this innovation fund. So quick budget update. The only real update that I have is with the May revise, the governor's May revise that came out. 2011 realignment did bump up a little bit. So we're looking at, if we went straight from this estimate, I haven't gotten, revised firm estimates from CSAC, which is where we usually get kind of our real firm estimates, but revised estimate based on the percentage that it went up, we'd be looking at about a $75,000 increase from what was put out in the budget documents. So relatively small compared to the size of the revenue budget. So, but at least positive thing, didn't go down, stayed relatively even. So that is my motion.
Thank you. Any questions? And any questions about the innovation fund? I mean, the way Andrew kind of laid it out, is I think we should just do the normal process that we've kind of evolved to what we're doing now as far as requesting for funds from that. And I foresee that maybe being, how we talked before of possibly groups outside of here, like, other community-based organizations that may want to try to tap into funds for some sort of project that they're doing, being able to submit a request as well, or maybe one of the departments submitting that request on their behalf relative to some sort of partnership that's occurring. It's another way that could happen. Does anyone have any feedback on that piece of it?
Did you say there's written documentation, right? Like, does it outline the criteria or like the maximum amount that somebody could request?
It doesn't outline any maximum amount. The only real specific criteria is that the innovation funds can be used for any expense that fits within the, legislated or the lawful expenditures of those sub-accounts. So that's why it's pretty broad, since you're looking at the juvenile justice sub-account, community corrections, DAPD, trial court security. And this one.
And maybe as a group, it's just me thinking out loud, maybe as a group, we want to set that aside for, as it's called, innovation funds for innovative projects that people come up with. But we set those parameters as the CCP of setting out some criteria and some things for people some framework for people to be able to submit those as kind of like, pilot projects, for lack of a better term. That could be up for discussion.
Did I miss how much what we expect is going to be the initial
200
council setup?
It's about a little over 200,000. So, yeah, ultimately that's, the legal basis of what it can be used on, but it's definitely, with the CEO and auditor and our group's agreement, ultimately it's the CCP sort of direction on how we want to.
So yeah, maybe not a ton of money for any one of these departments, but a significant amount of money for a community-based organization that's trying to stand up some sort of project that would help this population out. So
I think it'd be helpful to have some guidelines that could be shared with community-based organizations, like you said, it's innovation focused or whatever the parameters, the box you want to draw around it, and then some guideline of like what would be an appropriate request if they're.
yeah. So we can discuss that now? I mean, we could work on something and bring it back to the next meeting. Does anyone have any preference or comments or input?
I guess.
You'd probably know better than me.
It's a good question. I mean, ultimately, I've heard from a few that what they do is put it into the innovation fund and then sweep it back out into their AB 109 fund, and then a variety of different options. So I mean, seems like people are kind of all over the board in how they use that, but I could try and find out a little bit more details of what that looks like across the counties.
I mean, I would just say in like, when we first decided to do the strategic plan, I mean, even before, that's just several years ago now, but I think one of the discussions was making sure that when push comes to shove and the legislature starts looking at these types of fundings, like, I'm assuming the intent wasn't to sweep it back into that pool of money. And if every county's doing that, then possibly they'll say, well, then we're just gonna not give you as much money anymore. So I mean, that's another way to look at it, is that if we do it kind of probably more as what the intent was, then might be in a better standing than if we didn't. Does anyone on the screen up there have a preference or discussion about this?
Well, I concur with what you just said, Jeff. I'd rather see it be something that's available for special use related to innovative projects. Because so much of these funds kind of are rollover anyways. It would be a good way to allow us to do some things that might be more outside the box, then we can measure effectiveness.
So to get to that, maybe the next meeting, we'll just we'll do some research and see if there's anyone else kind of doing this, to see if we can get some kind of parameters around how someone would access those funds, or what the framework would be for that. Does that work? I'm seeing some head nodding. All right. And you're willing, anyone else besides Georgette willing to be in that group? I don't see any more head nodding. Angie is.
Yeah.
Okay.
We can come up with a draft.
Okay.
It's used for only fiscal emergencies where we feel that.
All right, so the strategic plan,
Is it called like the Innovator Fund or?
Innovation Fund.
we can rename it too if we want to, if we want to have a fun name.
Ask my chiefs. They do.
Yeah. So about a year ago, we sat in here, I think it says May 25th, 2022, and came up with a strategic plan with Kevin and Zach. And strangely enough, Kevin is upstairs today working on some pretrial stuff. But and some of those things, a lot of it, so goal one was CCP will be data-driven in decision-making and evaluating outcomes. And so we kind of decided that there would be a data subgroup. And so right now, there's a couple of objectives that go along with that. CCP will determine what data reports are needed to make informed decisions, create a representative work group to identify data elements to fulfill reports, explore funding and staffing of a data analyst, develop a template report format to report out to the CCP, and a standing agenda item to present and discuss those reports at CCP meetings. So for that to happen, I think the work group hasn't really coalesced, I don't think, or has come together. I know Brendan.
So we've had a meeting, some follow-up conversations. I share my screen here. I made a little bit of progress. In the first meeting, we discussed what the scope, what would encompass, what the scope would be. We decided we need to be tracking things that are related to CCP funds. One way to do that would be to only track felons. In terms of similar collaborations, we looked at the Stepping Up initiative and the way that data is shared. To do like a, what would you call it, process map, or the we had a process map where it's like a funnel of people. You start with X amount and it narrows down. So that was one concept in terms of presenting process data. We have the Teams group where I've got a dashboard started here. I'll show you here. Some of these graphs are actual graphs we have in it. We have like the PRCS population 1170, GLAP, some recidivism, data points. We could do like a map. These are just sample graphs to kind of fill space. These are, so like from that, same thing from that dashboard, citizen number of bookings. These are some of the ideas, connections to services, risk profile, demographics. But there, there was some confusion, I think, from some of the people involved in the group about what their departments might want to see. So maybe within the departments, there could be some conversations about what people like to see on the dashboard.
Yeah. Yeah. So when we originally talked about it, I think the idea was, what are we already collecting? Because that would be an easy first step of things that we already have, like widgets that we're already collecting. And then branch out from there. But I do think from this group, they need a little direction, empowerment to move forward. Part of that is, I think when we had the strategic plan, we talked about how, yes, this group had a specific purpose. When AB 109 was came about, but since we're all in the same room together, wait till Brendan can make.
I just left the meeting. That was.
That when this group came together, it was more about, rolling out AB 109 and how it would look locally and the funding and that sort of thing. But at this point, since we're all in the same room, that we can kind of expand on some of those things. So it's kind of, the sky's the limit as to what we want to see. I did write down on here, I think it's on later in the agenda, that I think that this group could, and I think Phoebe's on the call, that I think this group really could help support and kind of intertwine a little bit with the Justice Mental Health Collaboration and probably CalAIM to a certain extent. One thing I've done in the past is for both probation and the jail, or just the population as a whole, done kind of a offender or client profile so that we had an idea of like, what are the needs of all these people, and like using, the individuals that are in the jail, but our risk assessment. So it was like, okay, they need this sort of treatment would be the most effective. And we know kind of what services then we need outside the jail and what services we need inside the jail and those sorts of things. And then the funding gets tied to that because we fund those services that we show are in need. And sometimes you learn a lot of surprising things, like, early on in AB 109, it was like everyone needs education. And it turned out like 90% of people had a high school diploma already. So we didn't need adult ed as much as we thought we did. And certain things like that. So I think that group is kind of waiting for some direction and or just some freedom to maybe explore some of those things on their own, but just each person that you've assigned some sort of direction from whatever department that they're assigned to. So any comments? And a lot of like Brendan alluded to, I think some of this work's already been done through the Justice Mental Health Collaboration and the Stepping Up stuff. A lot of this kind of data matching and work has already been done. So I think this can just kind of tag on to some of that stuff and expand on some of that stuff relative to things that might not fall into that realm. Any comments, questions, concerns? And like, it gives us option too, recidivism. I mean, I've always thought, there's the state definition of recidivism, which we report out and which we have to report out relative to AB 109, but there's a lot of metrics that measure recidivism that are not in that state definition. I mean, it could be arrests, it could be, cases that are filed on but not prosecuted, or a variety of things that show that maybe someone hasn't gone through the whole cycle of the court process, but there's other things that can tell you, that we can collect that information and report out on that kind of stuff as well, as long as we have the information from, the courts or Jesse's office or Carrie's office or whoever that has that information as well. So any feedback on that or what, I mean, direction? So that Brendan can kind of try to get that group going a little bit better. Anyone on the screen up there?
Jeff, I'm I just want to make sure I'm tracking what you're saying. So like this data group would sort of piggyback on the work that's already happening through the stepping up group, but pick some different angles or go deeper with it in spots that are more aligned with AB 109 parameters. Is that what you're saying?
Yeah, so I mean, the CCP said we want to be data driven. But we also recognize that it doesn't have to be limited to just the small AB 109 population, since all the players in the system are here, that we could use that to garner more information as the system as a whole. And we had some objectives relative to that to help us in our decision making, but it's just trying to get to that point. The first step was gathering what reports we needed or what kind of data we wanted to collect. So we're still at that point of what do we want to know? What do we want to see? And not saying that it needs to be the be all and end all right now, because once, usually this kind of approach just results in more questions and, peeling away at the onion a little bit more. So we just need a starting point as to kind of from each agency, what they can provide and or what they want to see if we can find out relative to their agency.
And can you clarify too, or Brandon, maybe, you have a subgroup, right, the state focus, I think, our senior analysts on that group with you, maybe? Leslie?
Yeah.
And have you guys?
So yeah, she's talking about sharing the jail ADP data as a data point for the dashboard.
So, but if I understand, maybe just need a little more clarification, is that you guys have met, but you're really looking for more input from the group as to what direction the group wants to go in?
Well, yeah, because I think that the group met and some people were confused as to like, well, I'm not really sure what we're supposed to be doing here and that kind of thing. And yeah, so like ADP is a very high level thing. We could get that. And then maybe you drill down into like all the way to the individual needs, like I had said earlier. I mean, that's just one example. Or whatever you want to see that we can possibly use this group to help address some of those issues. But I think they just need a little more direction as to what those elements are that we want to see.
And is this dashboard going to be public facing?
No, I mean, it doesn't even have to be a dashboard. It doesn't have to be,
So
we could have a public facing.
BI. You can publish it publicly for free, or people that want to view it can have a cheap license. It's like, less than $10 a month, or a PDF can be generated.
Well, it doesn't have, like if this group, if this group decides that there's elements that we want public facing, then we can do that. But I mean, that's kind of like, we have a public facing dashboard on the probation site, but it's not everything that we have in all of our stuff. It's just high level stuff that if someone stumbles upon our website and wants to look at it, they can.
We have other data too, though. I mean, depends on what the groups, I haven't talked to the group. I don't know what it is, but we track like folks that have serious mental illness. It was all done through stepping up. We track down to the quarter hour of the amount of therapy minutes that are being provided to all the inmates that are in custody and things of that nature. I mean, we have a lot of data that is potentially useful. And Steve and I talked the other day more about telling the story of what's actually happening, like from the jail's end of things too, and the services that are being provided that maybe people just aren't even familiar with or know about, but we're also just not telling the story of what those things are. And so we can supply some of those data points, and whoever's on the group, we can work with them to make sure that that's shared. Corey had created reports before. They could be broken to some extent now, but they run generally still the same info. And so you pull those data sets and then you can, supply some of that information to services that are being, provided.
I think this would tie into like, you're talking about different sorts of services that folks get in the jail, that if we could get the information as to like, again, what would be the most beneficial services for the people in this community relative to the needs that they have, then we could fund those things through the innovation project or whatever, because we know these are the things we need. And a thing that I have later on the agenda that just briefly talk about that, there's a clearinghouse for this kind of stuff, that goes into like programs that address certain things and gives you a little color coded, whether they've been studied, they're evidence-based or whatnot, that Pew puts together. That in the past, Sheriff Moon has said, well, that'd be helpful that when we select programming in the jail, we could use that. But if we know what the people need, then we could hone it down a little bit more. And the same goes for, it's pretty much the same population coming out to us and vice versa, but we do the same thing with our individual needs of the people that come out to probation as well.
As a kind of getting started thing, if I remember correctly from the strategic planning, and that process was clunky, but when we were kind of doing all the, whatever slice of the budget that we had or what we were intending to, to serve, whatever program we were doing, isn't it kind of, you envision at some point at the end of the year that there'd be kind of a meeting that was reporting out on data about like where those monies went and who got, what population was served and how beneficial for the community. So, that would be, because I know sometimes it's difficult to kind of look at, okay, here's what we're spending the money on and how do we get data around reflecting what we did. So, that would be a good starting point individually for departments, is kind of look at how you're going to, I don't know the correct word, but visualize what you're actually doing based on the part of the CCP budget we're getting. So we still probably need to do some work on some of those things, but isn't that kind of what?
Yeah,
vision for one of
that was part of it. And I think we thought the low hanging fruit would be just, like I said, what reports, like I'm sure you guys do like BSCC reports, certain things that you already are collecting. So it's not a heavy lift. And we do a realignment report and some other things that we already have those elements that we could plug in and then go from there. And understanding that some of the things we fund are going to be easier to have outcome sort of data, and some of them aren't. Some of them are just widgets of this many people came in, this many people came out, and there's not really outcome data associated with it. But
part about like even the services that we provide, even therapy, which everybody knows is for the most part a beneficial service. There is no outcome for providing therapy.
Yeah.
It isn't like an end result that you can provide. That's a tough thing of trying to keep stuff on an evidence-based like type of thing. Like church, for instance, we talked about it when I was at the jail. We're going to limit how many days church was going to come in, because although it's good for the group, then we can't have other things coming into the jail, but you can't track how church is helping somebody like the internal.
Yeah, and a lot of these, we don't have the capacity to do a truly like scientific outcomes kind of study. Brennan can do like some simple correlations and some stuff like that, but and I say simple just in the statistical sense, not in like it's, his skill set or whatever. But yeah, we just need to start somewhere, and then we can get more complex and intense as the time goes on, as we learn things and we go, oh, we probably could do this now because we have this thing, but we just got to dig in and kind of get started. So
today, Jeff, are you looking for from us like specific ideas of what we want to be tracking, or buy-in that the data group's gonna be reaching out and that we're participating in that, or like what can we contribute to be helpful today?
I think all of Brendan, what would be helpful for you guys to get?
Yeah, I think, some of the analysts that were involved in this data group weren't really familiar with the CCP, so they didn't really, have context to discuss it. So maybe just bring them up to speed and talk about some of the things I'd like to see,
When does the data group meet again?
We haven't set a date.
What is, to that end, last time, is that each department have an internal meeting that starts. I like Steve's idea. I think that provides a good box around at least where to start. Is like what kind of data metrics would you look at to support your budget?
That works.
And the audio is a bit choppy, so if there's a date and an expectation that we're meeting and providing some information before that date, it would be helpful if that's captured and sent out to the group.
Yes, Georgette basically said to meet with your folks internally and kind of explain the CCP.
And I think Brendan mentioned the date of the
And
next meeting, so we'd
not,
wanna meet
not
before
yet.
okay.
Yes,
See.
no, one hasn't been set yet, so Brendan will set one and then I'll send it out to the exec committee as well so that you guys know when that is. And I'll send out another copy of the SMART objectives that we had, just so we can see those as a point of reference. Of what we had talked about last year. All right. Is there any other questions about the data group? I know that was kind of.
I mean, I have another comment in that, like, going back to the idea of blending the strands between what's going on with stepping up. It doesn't make sense to have a CCP separate, like, data work group and stepping up and IST and CalAIM. Like, ideally, those are all similar bits of information. And so anything that the group can pull from what Kevin's already put together, it seems like, to Sam's earlier point, you would be able to move from widgets of how many therapy sessions were provided to, like, what does it look like in terms of calls for service before that therapy intervention versus after, and really get to some more meaty outcomes and issues from that. So.
And almost the majority of folks that are on the data committee are also on at least one of the stepping up or the justice mental health collaboration meetings. So it should have some working knowledge of that as well.
I could reach out to Kevin to learn his process about matching the data.
All right. Or share, I mean, you can share some.
I mean, there'd have to be some kind of data sharing agreement where I would be able to match people.
Yeah. Any other questions, comments? Okay. The other piece on the strategic plan was the outreach. I know we've done some things. The last one, I think Carrie and I spoke to Rotary, I think it was, one of the Rotary groups. And so I know there was also a comment from some of the groups about doing like an evidence-based practices 101. So I'll try to work on figuring out who would provide that. But I think that would also not just go to internal county groups, but also people that we contract with probably to allow them to participate in that. And our objectives around that, and part of this comes from the survey, and even some of the judges were like, we're unaware of kind of what was going on with the CCP. Develop a written process to create and disseminate information from the CCP, share successful outcomes and stories through dissemination process, develop outreach method and invite community-based organizations to participate in CCP, and develop and produce at least one community education session by I think it was December of last year. So, I mean, we've done some of those sessions relative to different groups. And I think, again, and maybe this is another subgroup, that to stay on task with this, I feel like, because we did say multiple times about having a method and a written process and that sort of thing, of having someone or a group of someone's sit down and kind of develop communication plan. I don't know if Brian, maybe the Health and Human Services PIO, maybe Candace could help me out with this or help us out with this.
Yeah, it's something we can have a conversation with her. She's got a lot of other stuff on her plate, but between her and she's participates weekly in the PIO work group with the CEO's office. So yeah, let's elevate that.
Does that sound like, I mean, because I do think, I mean, just this is speaking for myself personally, like this kind of thing, yes, when it comes up and someone says, hey, can you speak at Kiwanis or Rotary or whatever? Yes, I'll do those things, but I think without some sort of a plan, kind of like we have with other communication things that we have where we every month have something that we're going to do, I think this will probably fall by the wayside unless we have some sort of process and plan to kind of do this outreach. So
Can you kind of recap what steps, I mean, you said you, Carrie, talked at Rotary. Has there been any other presentations or anything like that?
Yeah, presented, I don't know where else. There was another, like service group, that's been about it. But there was, I think there was a discussion about having a plan to be able to, when they did the community survey and even some of the stakeholder surveys of people just like, what the heck is a CCP? I mean, even community-based organizations are, why is there any value in it? What are we doing locally? I don't really know. So we had, one of our objectives was to improve community engagement, participation in the CCP. I had mentioned in a previous life, we had done a thing where we did like, it's almost like a little town hall of the cities. And it was like, you know, we had 4 or 5 little stations where there was a community discussion and a breakout about different things relative to the CCP. And like I ran one, the DA ran one, public defender ran one. And they kind of went around and got input and engagement with the community, like those sorts of things.
Do you see that kind of connected with what Angie and Georgette were talking about? Like if there's some kind of process, because obviously I'm talking to stakeholders and then you mentioned, hey, there's maybe some money, dollars available and here's the process and how to do it. That kind of perks everybody's, you know.
Yeah, and that's kind of the same thing in the similar with juvenile realignment, that to get people engaged, that's kind of what we're doing of like, hey, we have some fund balance. Come and learn about it at the meeting, you know.
And I don't think it's such a one incident, but it seems like they could be leveraged, which is the NCCLI, which, you know, the sheriff, Press Valley, Jesse, like, I think we multiple stakeholders participate in that.
Yeah, I spoke at the last one too, but
it's never specific about CCP, of course, but it could be added in as part of that conversation piece of it.
I tried to, but then she rang the shaker at me.
If all of us who are part of the CCP add a slide about it in our presentations to NCCLI, you know, or in the community academy, employee academy, that certainly is something that adds it, and they'll hear it repeated over and over and over. And if we're all using the same slide, maybe with our own department logo on it. I think it starts getting through to people what we're doing and that we're all working together on it.
All right, that's good. And maybe a part of the, you know, the PIO group will help us out. Maybe a part of that is just having a calendar of those events too, of saying like, this month is Community Academy or Citizens Academy. This month is Sheriff's Academy or whatever it is. And just so it, you know, so it reminds us that those things are coming up so that we remember to do those things. So does that work as far as goal 2, number 2 is involved? We're going to plan to engage those, a communication plan, which includes engaging those groups. As far as the NCCLI, Community or Citizens Academy and all those different things. Right. That works. The next goal that we had was ensure safe Nevada County by reducing and preventing crime. Update existing inventory of programs. I know we did that, but I don't feel like it was as robust. So I'll have Brandon will look at that and send that back out. Develop process to identify outcomes of interventions used for people involved in criminal legal system. I think that's part of the data group. Create law enforcement work group to explore information sharing and collaboration opportunities. I know, Alex, you texted me on that, but since you're here, I'll let you share.
Yeah, we've made it as far as identifying the people in each law enforcement organization that would be part of that. I see this as really an opportunity kind of on that piece we were talking about a minute ago on sharing the work and the purview of the CCP is probably the first step of that. And that's why I wanted to ask you, I can set a date, but then I'd like maybe some presenters from probation or CCP members to be able to talk to the law enforcement people in the room about what is the CCP? Because frankly, if you go talk to a street level police officer or sheriff's deputy, they're probably not going to be very well versed in, basically the CCP process, but I think that's an education opportunity that we can start with the people that have been identified in that group. So I'll work with you on that, Jeff, and we'll get a date going this summer.
All right, thanks. CCP will support the Justice Mental Health Collaborative through representation, providing data and resources. We kind of talked about that. Explore the feasibility and need for implementing a primary care diversion. I think that's done, isn't it, Carrie? Primary care diversion.
Oh, primary caretaker diversion.
Yeah. Sorry, I forgot the taker part.
And Cami and Susan are doing that and working with the court on it.
Let's say, because when we were asked, we said, it's fine. I mean, didn't sound like there would be a ton of.
No, I think it's gonna be very few. Just because there's so many exclusions.
Yeah. Improve CCP's understanding of the disparities that exist in Nevada County by producing DEI report. And I think that's also the data piece. That once we get that data, that when it's individual level data to roll up into the data that indicates the diversity, equity, and inclusion kind of piece relative to the folks that come through the system. That makes sense, or anything on goal number 3? Right. Last one, gather and analyze more data. Gather and analyze data to better understand the homeless population. So again, I think that the data group has to get together to, and that has to be one of the metrics in there. Utilize data report, and that might be information that's already collected. I mean, we collect that in our system. I'm guessing.
Wouldn't they be reaching out to like
home team
systems that already exist? And
yeah,
like the hot.
A lot of these are
home team, and
Yeah, and I think that was the thought process, is a lot of these things already exist out of there, and I think, if I remember correctly, part of the stepping up was, I don't know if you ran it through the HMS, is that what it's called, Ryan? HMS? HMIS, yeah, running it through that system, the homeless management information system. And I think some of that data already exists through some of the work that Kevin's done. So utilize data report to develop strategies to address areas and support existing service providers to build capacity. So again, it's the data piece. So it's all hinging on you, Brandon. No pressure. Any other questions about the strategic planning piece? Again, I think a lot of it has to do with the data group around a lot of the strategies that we identified. Any other questions, comments, concerns?
so it's just a question, because I mean, obviously I haven't been involved in a ton of strategic planning things, but
I didn't ask Steve to ask questions that if no one said anything.
Sorry, we're gonna ask questions. Obviously that document comes out, it's there, there's agreed upon things. There's a lot of planning that goes into that. But if there's things that, as this group convenes and gets more in depth on things, of like changes to that, or things where like, okay, this is, maybe at the time, but this is kind of mission creep now because there's 5 other systems in place and groups that are working on this issue. So it's probably not a CCP type of issue. Like, is that something to adjust that?
That's a fluid document. I think that was just to get information on. Some of it's like, not that we're going to solve homelessness, but just the impact on this system. And, is there anything we can do to support maybe those other systems? And maybe it's saying, hey, I know that's not true, but half the people on probation are homeless, or half the people on AB 109 are homeless. Maybe some of the funds should go to supporting some of those things that already exist out there to help this population as well. And that's just one angle of it. Also providing, I know other departments or other CCPs provide trainings for their community-based organizations. So if we decide like, one of the things that we're doing, whether it's through CCP funds or SB 678 funds, that the predecessor to AB 109, like let's say we're doing a motivational interview training, is to invite partner agencies and community-based organizations to participate in those. So that's another thing as far as probably outreach to groups, that when we have these things going on, I know we've done it in the past with like I can't remember the name of the training, the mental health training that now I think is required by post. But
CIT stuff?
yeah, crisis intervention training, but prior to it being required, we use some funding to hold it for the different agencies and different community groups to have those, to participate in those trainings. So maybe that's something else we can do as an outreach, as well as to get more folks involved. Any questions? I have program Clearinghouse. I spoke about that briefly. That's just essentially the program Clearinghouse. I think the Pew Clearinghouse takes about 8 or 10 different clearinghouses from around different organizations, different universities and stuff like that, that have compiled all these different programmings relative to different, you can put in there in the drop down, like, I want to address mental health with criminally involved individuals. And then it will pop up all the programs that have ever been evaluated, what level of evaluation they've gone through. And then you go, okay, I want it for females, or I want it for teens, or whatever you want it for. And then it'll pare it down. And then it will link you to information about that program and the studies, if you want to read the studies and all that kind of stuff. So I do think once we get through the data group, that might be helpful for the different groups when they're deciding kind of the approach that they're going to take relative to these populations. And that's kind of how we went through the process to determine the cost benefit of all of our programs. We used that to see how effective they were and their expected rate of return relative to recidivism, relative to the amount of dollars per person we were putting into that, to see kind of what our cost benefit was on each one of our programs. And there are some CCPs that do, and probation departments or different departments that do this, that going through that process as a requirement for submitting a request for funding. And not saying that they don't fund programs because they don't have that data, because obviously then you would never have any new programs because there's no information on them yet. But they would use that, but there's also a tool to address that. They would use that tool to look at programs when they request funding from the CCP, which I think down the road could be helpful. That at least shows that whoever is requesting money has put some thought into the process and who they're going to address, and whether it's an effective program or not, or has been shown to be an effective program or not. And we tried to pull up the Clearinghouse, but for some reason it's not working. So
I have it up now.
sure, you can just show it real quick.
I'll write that on, you can shoot it.
Oh,
For rejoining me.
all right, well, he's rejoining. A quick thing, like some housekeeping things, meeting format. So, this is up for discussion. I was gonna plan, just so this doesn't fall off everyone's radar, of just setting, 4 or 5 meetings, putting them on the calendar for the next 12 months. And then that way, and yes, if we, for some reason, someone says we need a meeting before that or whatever, then we could do that. But instead of the, hey, I think we'll do a meeting here, something happens, I think the last one when we were gonna do it, then I had to have surgery and then I just kind of dropped it off. So if we want to do that, I think that makes more sense. So then it's kind of set in stone. Everyone agree with that? Okay, so Linda and I will work on getting that sent out. The other piece is, I don't know if we want to have this discussion now, but we had started kind of a discussion as to whether, and I'd have to read if it says this anywhere, as far as someone coming as your designee, and how we want that to work as to like, you know, you appoint someone as your designee, or we say it's, you know, the seconds in certain offices, or how we do that. And whether we want just attendance or whether they can vote and that sort of thing. Does anyone have any, and I don't know if there's, you know, legal requirements around that according to CP or not, but.
Can you
does
have
anyone-
could you have somebody that's of a legal mind confirm that? I mean, I would be open to anything, but I think we should check that off the list first, because I do think the way the law was written, it speaks to certain positions by title, but that's not to say there may not be precedent to do it a different way.
Do we have anyone that's good with looking at legal stuff?
I'll do it.
Or county council or something, I don't know.
Carrie signed up for that.
See if I can figure
Well,
it out.
she does have the requisite letters after her name.
All right, so he's got the clearinghouse pulled up. So you see, it's pretty easy to navigate. You can search by, like, give it at the very top. You can search a specific program if you want to in that search bar. But then you can also drill down through these different things. And so, I don't know, just type in motivational interviewing, show them what comes up. And so, see, motivational interviewing is green. So that means it's been studied at the highest tier. And I forget how many studies that shows that it's gone into. And then if you go, gives you kind of a brief statement of it. And then if you go at the bottom, I think it shows the clearinghouses. Or you can click on learn more. And at some point, it'll show you a little bit more about it. So if you go up, that's the, what is that one? California Evidence-Based Clearinghouse for Child Welfare. And it will go through and give you information about it.
So Jeff, you're saying, maybe clarify, so this is a resource to find out about various programs that already are in existence.
Yes, so ones that have already been studied, or like, so from the sheriff's department's perspective, like, I mean, this is a while back, Sheriff Moon had said, okay, so if I want to add more, a certain kind of programming to the jail, I could use this and it would help direct me to like what's the appropriate programming, whether it's effective, and then who to contact to get either trained in it or learn more about it or whatever. Or if you already have a program, because I'm sure there's studies on church in jails. I mean, I'm sure someone's done some sort of study on religious interventions in jail. And okay, shows it is effective or isn't effective, or there's no outcomes or whatever, that you can at least have that information. So making those decisions. Let's see. The last few things that I had on here, wrapping up, was, and we've kind of already talked about all this kind of stuff, is just as we move forward, I think, again, just reiterating that, you know, we can use this group kind of beyond just AB 109. And one of the things, you know, discuss relative to as the population kind of shifts and changes, what the department needs are, and having those discussions here, individual departments, relative to criminal legal system. Say that for, I keep tripping up on that statement, but anyways, the department needs are, and having that discussion, because again, you know, when realignment started in 2011, the idea and kind of the population makeup was a lot different. I mean, in every county than it is now. And the idea behind what would happen and what has happened is a lot different. So as things shift, that we have those discussions and as department needs change, and I know that we've had these kind of discussions relative to budget. And I'm sure that once we get data, that might change those conversations as well. But I think that it's kind of, I mean, especially if we have this group that can kind of look into things like, I don't want to say the sky's the limit, but kind of is relative to what we want to try to find out. And I think that we have, unique population compared to some other areas to where we can drill down and kind of really make some changes in some things relative to, individuals and how they cycle through the system and different things compared to some other departments where, you're not going to get all these folks in the same room and, or you're not going to be able, on some of these things, even when we went through the mental health process, you can almost hand count some of these folks to where you could get to the point to where you could really focus on certain individuals. And I know in the past, we've done things like with the MyOkra grant, we looked at like calls for service. So I'm sure, there's certain people that cycle through the system with a handful of misdemeanors, but get 100 calls for service, whether it be Grass Valley or Nevada City or wherever, that maybe there's some sort of interest of something that we can do relative to those folks that are just very resource heavy, that are taking up a lot of resources.
Well, yeah, like one, we did some research with the responder or mobile crisis teams and how other counties look at funding those, and some counties do use CCP money to support the farm models. So that's like that too.
Yeah, and we've talked about a bunch of different things. I know that, Alex isn't on there anymore, but Alex and I have talked about the funding for the police department is pretty much when they go out and do some AB 109 stuff, but about potentially, there's the University of Cincinnati Policing Institute and some programs that they do of maybe doing some stuff that's different instead of just but doing the patrol piece, but also doing like a project, of doing some different things. And one of them that I did with them once was like, they do this thing where it's super weird. Like they take all your case data and call for service data, and it basically how certain people are interrelated with different offenses. So there might be all these people on the periphery and 100 cases, this one guy is involved in like these concentric circles kind of. And then it's okay, there's 5 people that are attached to maybe they're not the ones getting arrested or prosecuted, but are peripherally involved in 50% of the crime in the county, and then focusing on those individuals, but having support to do those sorts of things. And just a little different approach than just okay, well, we interact with some maybe 109 folks and we go out and we search them. And that's what we use the funding for. But kind of taking that next step into, a different kind of approach to those things. So. All right, we're about to the end. We are to the end. Any other questions, concerns, or comments? All right. Any public comment? I don't see anyone. And so I guess, can I get a motion to close the meeting? Nobody wants to close it. All right, second.
Second.
Fine, second. All right, 12:02. Meeting is adjourned. All right, thank you everyone for coming, and we'll send out those dates for the next one.
All right,
Hopefully.
bye, thank you.
Thank you.
He's on vacation right now, so. You got anything that started yet?
Thanks, Brendan.
Actual engineering days. I know they were waiting on. Yeah, they were impacts and stuff like that, as far radios and